Health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition.
With that being noted, I'm pleased to introduce today's presenter, Dr. Daniel Martinez. Dr. Martinez is a fellowship-trained physician who specializes in sexual medicine, andrology, and male infertility in Miami, Florida. Today, he's going to cover injection medication, syringe and dosing, injection techniques, support options, and then hold a live Q&A to close out the webinar. Alrighty, without any further ado, let's go ahead and get things started. Dr. Martinez, over to you.
Thank you, Ashton. First and foremost, I'd like to thank Ashton, the whole MenMD team, Austin, Carrie. You guys have always been very supportive, not just for me, but for my patients. I've been using MenMD now for over 10 years, I think. And it's incredible because I've never worked with another company that takes pride in providing such good care when it comes to providing a good high quality product, great prices. But it's not just that, it's the personal touch that you guys provide and the incredible customer service. You really, to you, all of you that work there, it's you guys are treating each of my patients as if they're your own patients. So I want to thank you all for supporting us, for supporting me and supporting all of my patients and everybody else, providing this sort of platform. Because I think this is incredibly important. I think we're using more and more of this since the whole pandemic. Obviously now we're doing things again in person, but it's opened up this avenue to be able to reach out to a lot of people. And what I call, it's educational and entertaining. Of course, everybody always wants to talk about sexual medicine because there's never a boring moment when we're talking about this stuff. So with that said, thank you. Thank you everybody for taking time off from your afternoon and partaking in this journey that we're going on today. Talk about what I call the redheaded stepchild of erectile dysfunction treatments, because everybody talks about the blockbuster drugs, the Viagra's, the Cialises. Everybody wants to talk about implants, penile prostheses, which are the oldest treatments. I'm a big fan of the Vimix or the intraurethral gel therapy, but the intracavernosal injection has been around for a very long time, since the 1980s, and it's a wonderful treatment option for men who have moderate to severe erectile dysfunction, or men that can't tolerate, say, medications, oral medications, because of some of the side effects. My own interest, I actually got interested in urology through, believe it or not, intracavernosal injections. My first introduction to urology, working with Ricardo Munares, who's a very famous urologist up in Boston University, was doing a project on intracavernosal injections. So this is a very dear topic to my heart. I'm in private practice in Miami. I'm also the chief of urology at Baptist Hospital, Maine, the director of sexual medicine, andrology, male fertility at the Cancer Institute, the Miami Cancer Institute, and I also teach FIU residents. Again, I'm a general urologist, but my subspecialty is in sexual medicine, andrology, and male fertility. So the bulk of my practice is that, but I do practice general urology at the urology specialty care. So let's talk about first why we are here. Okay, we're here because of this guy right here. So you're going to see this guy pop up a couple of times. And again, this is not for the faint of heart, of course. If this makes you nervous, turn off your computer screens right now, because you'll be seeing him quite a bit. What is it that we're trying to obtain here? Okay, in order for a man to get an erection, the stars have to align. It's a very complex process, right? You got to have all the different aspects: the arteries, the veins, the nerves, the architecture, the hormonal profile. Everything has to be in sync, including also psychological component. And what we're looking for here, the goal, is an erection that is rigid and sustainable enough for the entirety of sexual intercourse. That's the goal. And I tell guys, this is a realistic goal. I can almost guarantee you that you're going to have intercourse until the day you die. Guaranteed. Not with the penis gel when you're 18 years old, but we'll get you darn close. And so what happens when a man gets an erection is, first you got to have some sort of arousal, some sort of stimulation that will allow the nerves to activate, which ultimately then allows, it opens up the floodgates. It lets the arteries open up and relax, and lets all that flow of blood go into the penis. You can see it go from a smaller, more engorged, erect penis. When that blood fills up the corpora cavernosum, little, looks like owl eyes, right? So those actual eyes, when that fills up, that'll make the veins trap all the blood, because now the outlet gets essentially smushed to the wall and it prevents that blood from leaking out. The penis gets erect, you do your thing, and essentially that allows you to have intercourse. Of course, once you have the orgasm, then at that point the veins open up again and the blood flows out and you go back to the flaccid state. So again, we're talking about today because there's a lot of different treatment options. We got pills, we got gels, we got these injections, and we have the implant. And of course, you have a vacuum device, which also is available through MD, which allows men another treatment option. But today we're really concentrating on what I call, again, the redheaded stepchild, which again, I don't think it's fair. It's a wonderful treatment. It is very potent. It really has a very high success rate and also a very high tolerance rate. And some of my happiest patients are my injection patients. So what are we talking about, right? So ultimately what we're trying to do again is getting blood flow in and keeping that blood flow inside the penis. The goal here is, again, that erection that's rigid and sustainable enough for the entire sexual intercourse every time you want it. Realistic, that's a realistic goal. And this goal is not like in baseball. I tell this to my patients all the time. In baseball, doubles and triples gets to the all-star game. You're either striking out or you're hitting a home run. So if I get guys that'll come and see me and say, you know what, doc, I'm doing better. And I say, no, it's not doing better. I don't care how many pseudo or semi-erections you have. I don't care how many nocturnal erections you have. We're going for that home run every time. And so if pills aren't enough, if gels aren't enough, or you can't tolerate that, these injections are wonderful. And it's a combination of 2 or 3 different medications, all right? So we got prostaglandins, you got papaverine, and you have phentolamine. And so you can do either a mixture of all 3, or you can do a mixture of 2 of them, which is either trimix or bimix, okay? So the trimix has all 3. The bimix, you take out the prostaglandin, and you'll see why in another slide. And so depending on the severity of the patient's erectile dysfunction, I typically do a penile Doppler on all my patients so I can see how severe objectively their ED is, and that'll determine at what level should I be starting my patients on. And there's a lot of different concentrations. But you'll see here, you have bimix comes in about 4 different mixtures, and you can see the components there. So you see bimix 3, 4, number 302, and 10, and you can see the different components. So 15-0.5, that's the papaverine phentolamine mixture. And you can see in the trimix, which is on the bottom, also the different components. And that'll be the 3 components, prostaglandin, papaverine, phentolamine. And again, this is the art of this. I tell people I control the concentration, they control the dosaging. So we'll tweak this around probably a couple times just to get to that right dose. And the reason we don't want to go with the strongest one from the beginning is because that famous erection lasts more than 4 hours. Doesn't really happen with pills, doesn't really happen with the gels, but can definitely happen with these injections. And people laugh, oh, if that happens, I'll call all my partners and have them come over. They're laughing until they get to the emergency room and I explain to them what I have to do to bring that down. So you want to do this in a controlled setting. You want to do this with a professional who knows what they're doing. And that's why, to me, the Dopplers, the penile Doppler and ultrasound is so important, because that'll give me an idea of where can I start this guy at. Does it have to start real weak, or can I start a little bit stronger and be a little safer at starting stronger? The reason we'll not use prostaglandin in some patients, it's probably the more powerful of the components, but it can cause some achiness, a sort of burning sensation. And so because of that, some patients will do better with a bimix as opposed to a trimix, because it can be a little bit uncomfortable for them. And so that's really the reason behind using bimix versus a trimix injection, okay? Again, this is what the needle looks like. These are insulin syringes. You can see the syringe itself, it already has the needle built in. This is essentially, you'll get a bag full of these when you order these. They come in different sizes. This is the 1 milliliter syringe. They have numbers from 0 to 100. Each one of these units, these are called units, 0, 10, 20, 10 units is essentially 0.1 milliliters, okay? So if you take this and you fill this all the way to the top, it's not a lot of fluid. You're talking about only 1 milliliter worth of fluid. But I tell guys you want to start off slowly. So the first time you inject, you use 10 units and see how that goes. If that doesn't work, I tell guys wait 24 to 48 hours. You go to 20 units and see how that works. If that doesn't work, then 24 to 48 hours, 30 units. You don't want to inject more than once in a day, but you keep going up. And ultimately what happens is a patient will come back and say, I used a little bit and it worked great. An erection rigid and sustainable enough for the entire sexual intercourse. I used a lot and it worked great. Or I used a lot and it didn't work, in which case we'll change to a stronger mixture, okay? And so these needles, they're not very big, okay? They have different sizes, but I usually order something small like this, usually with this actual volume in the syringe, the 1 milliliter syringes. It's very easy and safe to use. You can throw it away. I will show some boxes. Actually, I have one right here. When you're done, MenMD can provide you with one of these boxes. You can throw away and then take them to your local hospital, or I think fire departments can also take them and get rid of them for you. We can again control the needles that we send you, but for the most part, this is pretty standard. With regards to adjusting the dose, we already talked about that. The MenMD will provide you with a rigidity scale, which is great. We're looking for, of course, we want 100% rigid. And so you can log and do a diary where I injected this much on this day, and this is my duration of my erection, and this is how rigid it got. And that'll allow us to be able to be a little more objective and say, okay, well, maybe we need to give you a different mixture to be able to get you to your goal. All right. Again, we're looking for the ideal situation is 100% rigid. When you want it, you do this, you inject just a few minutes before. We're looking for an erection that lasts less than an hour. So I tell guys, days of marathon sexing are done, unfortunately. We're looking for 100% rigid erection. And really, if we can get it so that you're using a low volume, so 30, 40 units or less, that's ideal, just because then the medication will last you longer if you're using less of it. You know, you get a vial like this, which we'll go over how to suck out in a second. And so you want this to last you a decent amount of time so that you're not spending or not using such a high volume. So how do we inject? A couple things. You have your medication vials, you have your syringes, and then you have the alcohol. The alcohol is just a regular alcohol pad that I'll tell guys, you know, when you want to inject, this normally comes with a, on the top, there's a little silver cap, which you'll take off. Then you'll clean every time the top of it. You clean the sides of the penis with the alcohol. Of course, then you take this stopper off of the back, and then you'll take the tip off. I tell guys, depending on what you're going to inject, you first want to draw air in. So let's say you're going to inject 20 units. All right. You take the actual bottle, you put the needle into the bottle. Okay, so you have it like this. You want to be careful because this needle is very thin. And so if you start messing around with it, you're going to bend it. If it's bent, you don't want to use it. Before pushing in, you want to flip the vial upside down. I know this may sound very trivial, but I've had patients actually inject air into their penis and wondering why they're not getting an erection and why their penis is getting all these lumps in it. You want to push in, so you get all the air out, and then you suck out, looking at how much you're taking out, which is, let's say here in this case, 20 units. Once you get about the 20 units there, all right, now you take it, here you go, you got your 20 units. You want to hit the actual needle so you get all that air out, maybe give it a little push out so you get the air out, okay? And now you're ready, all right? Once you have this, now you're ready to inject. Now, where exactly do you want to inject? Let's bring out here our good friend. So here you have your penis, all right? First thing I tell guys is you want to be in anatomical position. So you want to grab your penis, grab it from the head, especially if you're not circumcised. Because if you grab from the foreskin, you pull the penis out, all you're doing is pulling the penis and the foreskin out, and the glands goes back in. So when you go to stick the needle on the side of the penis, even though you think you're injecting close to your body, you're going to stick that right into the head of the penis. You want to grab the head of the penis and pull it out so you are in anatomical position, which is straight out. Don't twist. You start twisting, now the anatomy gets skewed, and you're going to end up sticking that needle in a place where you can get injury to the urethra, bleeding, things like that. So anatomical position, straight out, okay? The first thing I tell guys is where not to inject. So the picture on the screen is a beautiful depiction of what we call the eagle eyes or the clock. So if we were to take a picture like this of the penis, you cut the penis like this is a cross section. So the top and bottom is 12 and 6 o'clock. So that's 12 o'clock is this right here, 6 o'clock is this right here. Never want to stick your needle here or here. Why? You got a neurovascular bundle here, and you have the urethra here. All right, so you're going to have bleeding, pain, and all that. Really, what you want to inject is right along the side. Okay, so you want to come alongside it. Anywhere along the shaft is okay. Most guys in the beginning will do close to the base, but anywhere along the shaft is fine on either side. Either side. Okay. You want to spread the love. You never want to keep injecting in the same place. So you grab your penis, you pull it out. Once you're out, you want to come again. This right here is about the 3 o'clock position or 9 o'clock position. It's really more about a 2 o'clock. So you want to come in here, boom, push in. Once you're in, you push the fluid in, and boom, you're ready to go. All right. So in with the needle, push the plunger in, and then you're out. If you're doing it on the other side, same thing. Want to grab the penis, pull it out. Most guys will become ambidextrous, and boom, they're in, they push, and they're out. Some guys that are not ambidextrous, what they'll do is they'll grab the penis, and with their own hand, they'll come over the side like this, and then they'll inject, boom, right into the side and in. Okay? So you want to come again, 2, 3 o'clock, which is right here, or on the other side, which would be the 9 o'clock or 10 o'clock, again, depending on which way you're looking at it, but that's essentially where you want to be injected, okay? Never up here, never down here, and you want to be careful that you don't sky. That's why we don't say 3, 9, or that's why we don't say 3 and 9 o'clock. It's more of a 2 and 10 o'clock, because if we do this angle, it's fine. You don't want to do this. You don't want to start coming in like this, because if you start doing that, you're going to end up hurting yourself. The other thing, the other trick here is after you inject, you want to hold a little pressure in the area. We all have these superficial veins on our penis, and those veins, again, you're not going to do any permanent damage, but the penis may look like an eggplant for about 7 to 10 days if you hit one of those veins. So those veins you can move with your hand. The actual skin will move up and down and back and forth. If you inject and you hold pressure, there's a less likely chance you're going to end up with a hematoma there. And hold pressure for even if you hold it for 30 seconds is fine. 2 to 3 minutes is what we recommend, but holding pressure for a little while is probably ideal. And that's going to help prevent these hematomas. Again, do not inject more than once in a day, all right? Again, how do we mitigate these side effects? There's some of the side effects, of course, bleeding, hematomas, scar tissue. You want to, again, first injection has to be done with a urologist who knows what they're doing. So preferably a sexual medicine specialist or a urologist that feels comfortable doing it. You want to spread the love and never inject in the exact same place. Again, anywhere along the shaft, never the glands. So anywhere along the shaft, starting off at the base initially, left, right side. You never want to use more than every 24 hours. Again, I say about 36 hours is the ideal if you want to do it consistently. The vials themselves, you want to put them away in the refrigerator, keep them cold so they don't begin to lose their potency. And of course, the rule with MND is about 30 days after you puncture it, you should throw it away. All right. So that's by law what they say. And it's not so much that you might injure yourself, it's just it's going to lose its potency. A couple accessories that MND has done a wonderful job here. I have a couple right here. You have the insult tote or the insulin type of tote. If men who are diabetics are used to this, where they'll carry their insulin and these sorts of things, you can put the vials in here. This is a little cold pack that'll keep it cold. This is great for traveling. You have the insulin, which is a nice way of getting it so that you can draw it, especially some patients who have, say, shakes or they have any sort of issues with dexterity. You got the auto injector, which is a wonderful tool. The auto injector itself, we'll go over this real quick. So you have different components depending on the actual size of your needle. This is the standard 1 milliliter 100 unit syringe. What you'll do is you'll take your needle after you draw out the medication. You're going to want to leave the top on because it prevents you from injuring yourself. You pull this out, okay? It's already pulled out, perfect. You want to stick this into the actual hole, and you put it in, you close it. Now you're ready to rock and roll. Again, you want to make sure that you already have whatever fluid you have inside the needle. What you'll do is first you'll press this, so the needle comes out. That'll allow you to take this out, take the top off without injuring yourself, all right? Once again, you pull back. Now you'll put this on wherever it is you're going to inject, okay? So you get the penis. Let's not inject my hand here. Grab the penis, you put it on right there to the side, and then when you're ready to inject, you press first this button right here. That'll activate and put the needle into the side of the penis. And then with this finger, you'll push in, and you've already then pushed in the fluid. Once you're done, you pull out, and you're good to go. At that point, taking it out again, you want to be careful not to hurt yourself. Pull back, open it up, take it out, and you can discard it. All right. So that's another nice tool, accessory that you can use, which really has helped a lot of my patients. Those who are needle phobic, it's a wonderful device. So with that said, I think we're done with this part. Very excited to hear some of these questions that people may have, and I'll leave it at that.
So to get us started, we're going to start with some general injection therapy questions here. This person asks, in general, how expensive is each injection, and are they covered by insurance?
So these are not covered by insurance. I'll start off with that one because that's an actual easier question to answer. Unfortunately, you want to try to get to a point here where each injection is economical. How do you get there? You get there by using the smallest amount of volume each time to achieve the ultimate goal. So that's where the ult comes in tweaking. And the beautiful thing about MedMD is they allow me to be what I call the mad scientist, because I can play around with this. A lot of other compounding pharmacies won't allow me to do that. So getting to a point where you're using 10, 20, 30 units, that's going to be a lot more economical than, let's say, if you're using 100 units every time, obviously. The price will change depending on the components, so it's kind of a loaded question. I can't tell you the exact price for each, but I will tell you this much. Anecdotally, most of my patients do not complain of price once they get to a point where they know how much they need to be able to achieve that goal with the smallest amount of volume necessary.
Alrighty, so another general injection therapy question. This person says that they struggle to get their penis extended enough to do the actual injection. They want to know if there's a trick to do this or something that could help them.
That's a wonderful question. So I have some patients who have some difficulty injecting, being able to stretch their penis out, whether it be for different reasons. A common one being some patients who have a much larger suprapubic fat pad, where the penis can sort of get sucked in. So positionally, you can play around with the position of laying down flat. Sometimes gravity works well. You can also use, let's say, a vacuum device to your advantage, where you can actually pump up the penis, give yourself an artificial erection, which then allows you to have more real estate to play around with while you inject. A wonderful, wonderful tool is if you have a partner who is willing and able to, that works wonders. Now, of course, not everybody has a steady partner that can do that, or now you're putting a weapon in your partner's hands. You better make sure that you're not misbehaving, or else they're coming at you with a needle to the penis. But that works great. I've had plenty of patients who have brought their partners in for injection teaching, and really takes care of the problem. The auto injector is wonderful too, because a lot of guys who can't see or have difficulty, they can do it by feel. They try to stretch it out as much as they can. Once they're stretched out, they find the area just by sort of having an idea where they're going to put it in, and then boom, they press the button and they're able to inject. So those are all little tricks I would say that I've learned over years that works pretty well for my patients.
Certainly, certainly. Alrighty. So this is a follow-up to that kind of similar question. Does the injection have more effect when the penis is somewhat stimulated? So even for someone that doesn't have this issue with finding an injection site, I guess.
No. You're stimulated or not stimulated. Obviously, stimulation will help enhance the effect of the medication. But the medication will work the same way whether you have a pseudo erection or a fully erect penis versus a flaccid penis. Now, these medications are very potent. They work through a totally different biochemical pathway than the pills do. So that being said, you can inject, and I don't care if you're going to church, you're going to end up with an erection. But if you inject, and let's say you have stimulation with the injection, you're going to have a much more potent response. I'm not sure, depending on which way you're asking this question. Is it injecting while erect or flaccid? That's better? Or if you inject and then you have stimulation, that's better than just injecting and not having stimulation? That's why I answered it both ways.
Yeah, awesome. Next question here. So you briefly covered this with how you kind of decide the dose and concentration for your patients, but this person wants to know if they happen to inject more than the required amount, will it still be safe for them? So I guess if they're taking a higher dose is their question.
Yeah, you want to be very careful with that. That's exactly how someone can end up with this famous longer than 4-hour erection. Yeah, you want to, that's why with this sort of therapy, you want to be controlled. I got some guys that, maybe they're getting a little bit antsy because they haven't really achieved, they haven't gotten to that point that they're trying to get to. And they have a hot date and so they'll inject more. That's really how you can get into trouble. So you want to try to stay away from that and not do that.
So this question just came in the chat, and I'm going to ask it now because it kind of goes along with the two prior. So this person asks if you can use a vacuum pump right before injecting.
Yes, you can. That again is a nice way. Now, when you got more blood in the corpora, that might increase your risk for hematoma a little bit more. So if you do it, you want to inject, and then you want to definitely hold that pressure.
Next question. So this is, I wouldn't say a general injection therapy question, but more so a comparison of modalities. They want to know how intraurethral gels compare to injections. Is one more effective than the other?
So the intraurethral gel therapy, which I'm a huge fan I consider sort of an in-between for pills and injections. So let's say you got a patient who's almost there with the pills and they just need a little bit extra. The gel's wonderful for that. Or let's say, pills work, but they can't tolerate the side effects. Wonderful as well. It tends to be not as potent as the injections. Again, these injections are pretty high-powered stuff, especially when you get up to the higher concentrations. And so you can't really compare. It's like comparing apples to oranges. They're still fruit. They're still within the great treatment options that we have for erectile dysfunction. But I consider it sort of a weaker treatment. So again, in order of treatment from the weakest, less invasive to the strongest, most invasive, when you're dealing with erectile dysfunction treatment modalities, you got pills, of course, less invasive because you're just putting something in your mouth and swallowing it, but they tend to be weaker than gels, which you're putting in the urethra, so you are sticking something into an orifice, and you have to absorb it, which is weaker than shots, which again, you're sticking a needle in your penis, which is weaker, of course, than an implant, which is a surgery, but it's the strongest therapy. Nothing works, an implant's going to work, guaranteed. And so the gels is just another weapon that we use here in the armamentarium for treatment of erectile dysfunction.
Next question here. So saw some similar questions. This one was worded this way. They asked, how many years can the injection work before needing a new treatment?
Indefinite. I've had patients that have been injecting for decades. If it's still working, no, keep using it. If it broke, don't fix it. If it's something that has been working for you and you're tolerating it well, it's not a problem. Unfortunately, erectile dysfunction is a progressive disease. And so as you get older, the erections are going to get worse. And so that's ultimately what happens, is you see guys having to use stronger and stronger injection therapies. It is not because they lose potency, it's just you're getting older. And erections get worse. But you can keep using it as long as it's working.
So I guess a follow-up to that would be, for someone that's finding injection therapy is not working for them, what would you recommend their next step of treatment be?
So you have a couple options. If the injection therapies are not working, of course, you can go up on the concentration of the injections. If not, you can consider combination therapies, injections with pills. But ultimately, if it's not working, the next step in the algorithm would be to replace a penile prosthesis. And my happiest patients are my implant patients. I don't know if they're happy because an implant is just so great, or they're happy because they go through this journey, they get to a certain point where they just know there's no other option for them. And so if you follow the algorithm, the next step, if you maxed out injections and not working anymore, and or you're just not tolerating it well, is the penile prosthesis.
Next question here. Can injection therapy inhibit one's ability to ejaculate?
It should not. There's three components to the sexual experience. You got the erection, you have the orgasm, and you have the ejaculation. So if you're able to ejaculate, let's say with other therapies, you should be able to ejaculate with the injection therapy. Now, I have some guys that say, doc, I don't get it. I can't get erect, I can't maintain it, but I'm able to orgasm and ejaculate. Yeah, because they're different. It's a totally separate thing. And so if you're able to ejaculate normally, you should still be able to ejaculate with the injection, including orgasm. Same thing with orgasm.
Next question, moving along here. These two are asking about effectiveness of the treatment. So first one, this person wants to know if injection therapy would be effective for them. They have not had an erection in over 2 years.
It's kind of a loaded question. Injection therapy is an option for everybody. But my advice for the person who posed that question is get evaluated. Go see a sexual medicine specialist and have them start you on this journey. And this really is a journey that I go through with all my patients. I tell everybody, I say, look, I'm on this roller coaster with you. Let's try to get you to our goal here. It's a realistic goal. And so they may very well end up with injections if that is what they need and they're willing to do it and they believe that their urologist thinks is the best option for them. So the simple answer is yes, of course it's an option.
Alrighty, and next question, kind of in the same line. This person wants to know, if you happen to stop injections for a few months, say, what would be the best way to begin again, as far as dosing and time?
You should always be conservative, especially with these injections, because of the potential for the polypisms. So I would recommend, if you're going to do it, and you go a long period of time, especially if there's some other parts to your history, new medications, you had surgery, maybe you've been rehabilitating with a vacuum device, start from scratch. Get back to the 10 units and work your way up again. 10, 20, 30. If you knew you were injecting 40 before and you're nervous, you're worried, start to 10 again. There's nothing wrong with that. Now, if you start and stop and really nothing has changed, you could probably go back to your normal dosaging that you were used to using previously. Remember though that the vials have a shelf life, and so you want to make sure that it hasn't expired. Day one that you crack it open, it's going to be a lot more potent than the last day that you get rid of it. And so you may need to inject a little bit more depending on how old that vial is, and if it's real old, then it'll pass the recommended date that MD states, then you want to buy a new one.
Definitely. Alrighty, so next we're moving on to some injection technique questions. And now that we have you full screen, I was wondering if you could just do another brief rundown of how to find the best injection site.
All right, so we'll bring our friend back in here. So there he is. So first thing is anatomical position. What is anatomical position? Okay, you gotta grab the glands, the head, not the foreskin. If you're not circumcised, if you grab your foreskin, you pull forward. What happened? That head's gonna go back, and you're gonna stick your needle into the side of the penis, and you think it's the side of the penis, you're sticking it right into the head of the penis. So you want to grab the penis and pull it straight out, anatomical position, okay? Don't turn it, because you turn it like this, now what happens? You're skewing the anatomy. Now all of a sudden you're going to stick your needle into the urethra, or you're going to stick the needle into the neurovascular bundle. So straight out, all right? Once you got it straight out, you want to first look at your danger zones. What are we talking about danger zones? So the parts of the danger zones are the 12 o'clock position, which is this part right up here, right there, and of course the 6 o'clock position, which is the bottom part right here, all right? Why is that the danger zone? Because that's the urethra and the neurovascular bundle. Really, you want to come along the sides. All right, so you want to do this is what they talk and they say is 3 o'clock position, or 3 or 2 o'clock, or over here, which is the 9 or 10 o'clock position. Okay, so you want to come right along the side and inject. Boom, boom, boom. You don't want to skive like this. You want to go straight in perpendicular. This is about 9 o'clock. This is about 10 o'clock. This is over here again about 3 o'clock, and this is about 2 o'clock. Straight in. You can go anywhere along the shaft of the penis, never the glands, but most guys will be close to the base, and you want to spread the love, never inject in the exact same place every single time. You want to stick the needle right in, boom. Don't want to just little bit, no, the whole thing in, because if you don't push it all the way in, you're not going to get into the corpus. That's the key. Once you're in, you give it a good push, take it out. After you're done, you hold a little pressure there with your finger, maybe 2, 3, 4 minutes, and that hopefully then will prevent the hematoma, which again, is very rare. But you want to be careful with those superficial veins. Those superficial veins can bleed. It's not going to cause permanent damage, but your penis will look like an eggplant for about 7 to 10 days. It'll go away. It'll get better.
Alrighty. Thank you for that demonstration. So we have a couple questions here about injection technique. First one, person wants to know, what is the best injection technique for men with a large belly?
So that goes back to the original question of having difficulty of finding the penis, or being able to stick the actual needle injected into the appropriate spot in the penis. Guys have a large belly, they can't see it. Sometimes you can do it by feel. You grab the penis, pull it out. That's where this auto injector comes in real good, because you pull it out and you can just you'll feel where it's at, and it's the right spot. You press the button and you're good. Gravity is your friend. Sit back and everything sort of gets pushed back, and sometimes by lifting your head up, you'll be able to see it. The other thing is your partner. If you have a steady partner, a willing partner, your partner can learn how to inject, and that typically works pretty well. Again, you gotta have a steady partner, a partner that's willing to do it. And I joke, but it's true. They're coming at you with a needle, so you gotta have a lot of faith in them. But it's pretty simple. I've taught plenty of partners how to inject. And then of course, lose the weight. They say 10 pounds is an inch. I don't know how true that is, but losing some weight might help as well.
Certainly. Alrighty, last injection technique question. Got this a couple times. So this one was worded, what injection techniques can avoid scarring or other damage to the penile tissue? I know you talked about switching the sites, but they want to know if there's any particular steps or precautions to take.
Yeah, switching the site is really ideal. I put a lot of my patients on a rehab protocol. So most of my patients are on a daily dose Cialis already, which helps increase blood flow. A lot of my patients also have a vacuum device. Vacuum devices are wonderful. And what that's doing is it's really rehabilitating the penis. It's helping break up some of that potential scar tissue that you might develop even without injections, getting good blood flow into that health and keeping that corpora nice and healthy. So a vacuum device is a wonderful way of rehabilitating the penis and maintaining it scar-free, we'll say. But really the goal here and the key to preventing that is spread the love. Spread the love. The guys that really get in trouble are the guys that just keep injecting the same spot, same spot, same spot, same spot, same spot. You want to spread it. Not only over time will you develop scar tissue, but that's going to cause peyronie's and other things. So you do have to be careful, and you want to try to move the areas where you're injecting in order to prevent that.
Alrighty, I actually lied. We have one more injection technique question here. So this one says, the needle often bends when injecting. What causes this and how can I prevent it? We actually saw this one more than twice.
Yeah. So here's the good and bad thing about using these very tiny needles. Right? These tiny needles, obviously, the tinier the needle, the less you feel it. But the tinier the needle, the easier it is to bend. So common pitfalls, okay, I see a lot. One, putting it in, so somebody goes in and all of a sudden they do this and boom, they start bending and they start twerking the needle back and forth and that bends it, all right? Two, not having that appropriate technique of stretching, okay? So you get a good area that's nice and flat. Three, coming in at that perfect angle, perpendicular angle. Perpendicular, I mean not coming in like this or coming in like this, okay? Because if you do that, look at that. Just with Mr. Limpy, who's really soft, I already bent this a little bit. So you want to be careful with how you're putting it in. Put it in and then press a button and that's it. The other part that we see bending of needles is, of course, the guys that aren't having back in their penis. If you're the type of person that injects in the same spot every time, what's going to happen? You're going to get a plaque, try to stick this very flimsy needle into that plaque. It's going to be difficult, number one, to get the medication in, but probably going to end up bending that needle. And so going back to how important it is to spread the love and never inject in the same place. You want to inject in different areas because that's how you're going to get to a point where you're going to keep good, healthy corpora, which in turn will keep that needle from bending and or having issues with it.
Awesome. Alrighty, moving along here, we have a couple injection storage questions. So first one says, we know that you cannot use your vial after 28 days, but why? What would happen if I were to?
Yeah, the issue here, of course, is the quality control. And so number one, the medication starts to get denatured. So after a while, we're not talking about this isn't a French Bordeaux. It's not going to get better with age. You're using it at 6 months, you might as well just be injecting saline into your penis. But the other problem is, of course, you can develop infections from it. The medications themselves, you can end up with some damage to your penis. So you want to be careful and follow those rules. One, because you're not going to get any benefit from it, but two, you might end up hurting yourself.
Definitely. Next question here. Haven't seen this one before, but I thought it was fairly interesting. This person wants to know how to recognize vial damage from shipping in 90+ degree temperatures.
Well, so the beautiful thing about that, and again, I can appreciate that because we're here in Miami, Florida, which of course is 90 degrees even in December. Menody's been wonderful because of the fact that they ship it in cold. They give you those blocks of ice that keeps it nice and cool. If you put the medication, if you feel that medication, let's say you go on vacation, medication gets delivered on a Monday, you don't get back until Friday, and you know it's in a place where it's 90-something degrees for 5 days, forget it. Don't use it because it's probably not going to be good. If you see, let's say, it should be a clear liquid. If it's not clear and or cloudy, don't use it. If the cap, there's a metal cap. This has already been opened, but there's going to be a metal cap, silver kind of same color as this. If that's not on it, don't use it. If you see a crack in the actual vial, don't use it. If you see any tampering here, don't use it. Once you get it, and as long as it's still cold, you'll feel it, you'll know it. You open it up, and you're going to feel that cold because they come in with those ice packs. Keep it in the cold. That's going to keep it from, again, being denatured. It's going to keep it nice and potent and active. And it's going to prevent any sort of damage from the heat. It can tolerate some heat, so it's not, I wouldn't say heat, it can tolerate some normal room temperature for some time. It doesn't have to be frozen all the time. Let's say I tell guys, if you're traveling and you're going to keep it on you and it's a short flight, no problem. You don't have to worry about it. But that's, again, the key word. The wonderful product is these influence totes that people use, because that's going to keep it cold. And you can travel with these things. This is a medication, just like any other medication, like insulin or something like that.
Yeah, and I wanted to add just one more thing about the shipping for the medications. So all the medications, especially the ones shipped on ice, travel with special stickers that will turn colors if the medication has been exposed to excessive heat. So you'll have an indicator right on the vial, right in the package, to let you know whether or not it's experienced excessive heat, it's been outside for too long, it was shipped, the ice is melted, whatever the case may be. And then if that's the case, you can reach out to MinMD to get it overnighted. We'll re-ship you your medication, make sure you get it there in time and at the proper temperature.
Oh, that's good to know. I didn't know that.
Yes, thank you, Austin, for that. Alrighty, moving along to some more questions here. These ones are going to be a little more specific, but a few of them were asked more than once. So first one here, this person says they had a prostatectomy done and they're wondering if injection therapy will work for them.
Again, the answer is yes. I would recommend getting evaluated by somebody who knows what they're doing. Starting again, I'm very methodical with the way I treat my patients. I typically start with pills unless the patient has a very strong history of ED already and/or they were using injections before. But many of my patients who have had a prostatectomy do end up with injection therapies. I don't do a lot of cancer, but the people that come see me with ED, a lot of them do end up with intracavernosa injection therapy. I'll add an extra part to this question because it's something that may not be asked, but people may want to know this. Yes, after a prostatectomy, it takes 6 to 12 months to regain, or it could take 6 to 12 months to regain your erectile function or your new baseline, right? That does not mean you should wait 6 to 12 months before you get any therapy. The moment you get cleared for sexual activity, I tell guys, come see me. Let's get you started. We need to get to injection therapy initially because that's what you need. No problem. You can always cut back on the therapy. You can go from injections to then pills if you needed to at some point, if you rehabilitate yourself. The best thing to do to rehabilitate yourself is to have good erections. And if that takes getting on injection therapy for a short period of time, do it. No problem. So the short answer again is yes. It's definitely an option for somebody who's had a prostatectomy.
Alrighty. They're asking if one has Peyronie's disease, if it's permissible to inject on the side of the penis with the scar tissue.
Again, the answer is yes, you could. It's interesting. I have used injection therapy to try to improve Peyronie's disease. So let's say you have Peyronie's disease, which is some scarring or a scarring phenomenon on one side of the penis, which is creating a curve because it causes a tethering device. It causes a tethering of that corpora. So if you start to inject on the other side, try to do it directly across, you will over time actually develop some scar tissue on that side, which is almost like a plication. You do a surgery like that, and you may end up straightening out the penis. So you can kind of use that to your advantage and try to straighten the penis out by doing an injection directly on the contralateral side. But can you inject? Yes, you can. My advice, though, of course, if you have a plaque, it's a dense plaque, don't stick the needle there because you're not going to be able to get the medication. Spread the love again, spread the love. But if you want to try it, and this is something I wouldn't recommend doing it without the assistance of somebody who knows what they're doing. If you want to try to take advantage and maybe create some scar tissue, like a little plication on the other side by injecting on that side, you may end up straightening out the penis. And who knows, that might be beneficial for you.
Definitely. Alrighty, moving right along. Next question. After the medication takes effect, the penis points to the right side. Doesn't matter which side is injected. Can this be helped?
So it could be two reasons. Number one, you may have Peyronie's disease, in which case that need to be treated. Again, you want to seek a urologist who knows what they're doing there, somebody preferably sexual medicine subspecialized. It may be that it's just not strong enough. It's not a strong enough injection. You'll have maybe that corpora start to fill up, and then it just sort of, instead of going all the way rigid, you're just getting sort of a semi-erection and tend to lean on that side because of the fact that you're just not getting a strong enough concentration of an injection there. I've also seen guys complain of that, and actually what they're seeing is that the penis doesn't fill up. All they're doing is they're getting a hematoma there, and so that leans towards that one side. So there's a lot of different potential situations there that each situation needs to be treated differently. A great tool, if it happens, take a picture and take that to your urologist so they can see that. Because if they see it, they're going to be able to get a better idea for what's going on there, which ultimately then will dictate what you need to do to fix that.
Next question here. With giving injections, if the first injection doesn't work within 30 minutes, can I administer a second injection?
That's an easy one. No. Never want to inject more than once in a day. Right? That's part of where, doing this in a controlled setting and getting to a point where you're at that ideal injection concentration dosage. So if for some reason you inject, it didn't work, it's a wash. You gotta hold off and wait 36 hours before injecting again. So the short answer is, and the easy answer is no. You should not inject more than once in a day.
Yep. Alrighty. Next question here. Been using Trimix for 10 years with different strengths, but I'm noticing it doesn't work as it used to. Do you think that plaque could be a problem?
If you've been using it for 10 years, again, in 10 years, your erection is going to change. No way around it. We're all doomed. Again, the good news is plenty of things we can offer you, and you'll have sex until the day you die. But it's not going to be with that penis shell when you're 18 years old. It ain't happening. Could it be related to plaque? Yes and no. More than likely, it's just related to the disease. It's advancing. You're getting older. There are, again, certain things you can do, rehabilitation protocols. If you do have some Peyronie's disease, you could try to treat that with, again, it's a whole different treatment algorithm. But unfortunately, the biggest issue here is you're getting older. As you get older, the erections are going to get worse.
Alrighty. Next question here. Why at times using the same exact dosage do I get an erection and at other times a semi-erection?
This is a great question. This is part of what I ask my patients all the time when they come to see me, especially as we're learning to use these. So if I have a guy that tells me sometimes it's great and sometimes it's not, same concentration within the same time period. Because if they tell me that, oh, I used it 6 months later after I opened it up and it's not working now, well, that we know where that's coming from. That typically is a technique issue. And so for us to do this all day, I mean, notice I feel very comfortable showing you guys how to do it on Mr. Limpy here. I can do this with my eyes closed. Typically, it takes some time for people to really learn a good technique because if you're noticing sometimes yes, sometimes no, it's probably a technique issue. And so that's the importance of the follow-up. I see all my patients every 4 to 6 weeks with this issue because it keeps them motivated. It allows me to teach them better. And over time, they're going to become their own experts. And they're going to be able to do this with their eyes closed the same way that I do.
Alrighty, moving along to some general questions here, not necessarily all injection questions, but first one is, this person wants to know why their erection goes away after they lie down when using injection therapy. They want to know if they could possibly have a venous leak.
So that's also a very common situation. The most difficult position for a man to maintain a good, rigid, stable erection is actually laying down flat. Why? Because of gravity. Gravity's going to sort of pull everything back. And so, yes, it could be related to a venous leak. Yes, it could be related to just severe erectile dysfunction, whether it be arterial insufficiency or venous leak insufficiency. But that just tells us that the erectile dysfunction is more severe than what they're thinking. So they may need stronger therapies. They may need other therapies. I have some guys that mitigate that by using stronger concentrations, more injections, more dosage of the injection. Some guys will use a vacuum device with a ring. And of course, some guys, if it's not working for them, then ultimately you can proceed with a penile prosthesis, which guess what? Erect, you're going to have any position that you want. That's a very common scenario because that is one of the toughest positions for somebody to maintain because of gravity.
Alrighty, next question here. This person, it's kind of going back to some dosing questions, but this person wants to know, do higher doses make for stronger erections or just extend the length of time the erection lasts? Or neither?
Both. So using higher dosages can give you a stronger erection. Using higher dosages can also give you longer erection time. Again, we control the concentration, what actually goes into that chart that you saw that had the 3 different numbers for trimix and 2 different numbers for bimix, but the dosage is controlled by the patient. And so, of course, if you're injecting 20 units and that's giving you a 90% rigid erection for about 15 minutes, well, going to 40 units is probably going to give you maybe 100% rigid erection for about an hour. And so it can affect both, which is a good and bad, right? That's what you want to do when you're trying to figure out what you should be doing. But remember, if you overdo it, now all of a sudden you're going to be with that erection that you're not going to know what to do with after 4 hours. And so that's why you want to do this control in a controlled setting and do it stepwise.
Certainly. All righty. Next question here. This person wants to know if you recommend using topical lidocaine to minimize pain at the site of an injection.
I've never had really good luck with topical lidocaine for this. I have patients that do it. Some of them swear by it, but I haven't really, it's not something that I use quite often in my practice. Can it be done? Yes, absolutely. But I find, it's squamous epithelial. It's squamous epithelium on your penis. So it's pretty tough stuff to get the lidocaine to sort of absorb in there. And so I think a lot of it is more of a placebo effect. But is it a potential option? Absolutely, sure, you can do that. There's also one other, actually, sorry to interrupt, there's one other issue with the lidocaine. You can use the lidocaine, but we use that sometimes for premature ejaculation because it numbs the penis up a little bit. That may also, unfortunately, carry the risk of possibly making the erection a little weaker than what you're looking for, especially if you're using it in a small site, probably not. But if you're lathering it on the penis, you gotta watch out because that may affect the quality of the erection as well.
Next question here. This person wants to know if one were to have a penile enlargement, I'm assuming they're referring to girth enlargement, would trimix injections still be effective?
You have to be careful with that one too, because now most of these girth expanders, if it's something like fat or whatever, they'll be outside of the corpora, and so now they're increasing the distance between skin, which is where you're piercing the injection with, and the corpora. So you may not reach it. That's number one. Number two, obviously, let's say you have a pneuma, which is essentially a prosthetic. You don't want to start sticking needles anywhere around that because that's going to get infected. So kind of a loaded question is something you want to talk to your specialist about. They have the option of using longer needles. So this is a shorter needle. There's a needle's about twice this length, which may be beneficial depending on, again, what source we're talking about and how much depth you have to get into in order to get the medication into the corpora.
All righty. Next question here. This person wants to know, do I need to inject myself at least once a week, or can I skip 3 to 4 weeks without harming myself?
It depends on what the goal here is. So using this for sex and you don't really care about anything else, you can use it as often as you like. The more erections you have, the better off you're going to be. And so that concept of use it or lose it is kind of true. So if a guy, let's say they're trying to rehabilitate themselves, they're trying to improve their erections, maintain good sexual health, you want to have erections. And if the only way to get that is with injection therapy, then you probably, want to do it more frequently. What's the amount of time? Well, there's no actual amount of time that I could tell you should have 2 erections at least a week. No, but the more you have, the better off you'll be, at least from a good penile health standpoint. So do you need to do it? No. Would it be beneficial? Probably, especially if you're not having any other erectile function without it.
Alrighty. I believe you covered this about priapism, counteract, but it's coming up a lot in the chat, so I want to go over it again. Can you use Sudafed, and if so, what is the recommended dose?
Yeah, so we do use Sudafed. Sudafed is essentially the antidote, right? I don't like it. Me personally, in my practice, I don't prescribe it because of some of the potential side effects, increasing blood pressure, which can cause some issues. You could get it out there, and the dosaging, again, I typically do my own mixture when I'm going to an emergency room, say, setting and treating somebody who has a priapism or erections want to go away after more than 4 hours. I don't incorporate it in my practice because of the potential risks. I typically monitor that when somebody goes to the emergency room. We put a blood pressure cuff and we monitor that as we're giving the injections to try to bring the erection down because of the potential for hypertension or increasing blood pressure at dangerous levels. So I don't normally prescribe it to my patients to have it at home. Some people will buy Sudafed and take it orally, but again, that doesn't have a very high success rate. And not only that, you may need more than just an injection of the Sudafed or the phenylephrine. You may also, in order to treat it, you may actually have to aspirate and get rid of some of that blood first that's sort of trapped inside the penis before injecting.
This person says the injection desensitizes their penis. What may be causing this?
I'm not quite sure what they mean by the desensitized. Remember, again, some of the components can make the penis a little more sensitive. Sort of that burning sensation, that's the prostaglandin, so it could be that. Desensitized in the sense of maybe having a quicker orgasm or premature ejaculation. I'm not sure what to do about that. I'm not sure that's really something that can be fixed. If the reasoning behind this desensitization or that sort of it's probably more hypersensitization or sort of that burning sensation, that's probably the prostaglandin. And so maybe switching from a trimix to a bimix might be beneficial for you. But desensitizing in the sense like feeling things a little more, or maybe achieving orgasm or ejaculating too quickly, there are other therapies that we can give for that, but they may carry as a side effect erectile dysfunction. So you got to take the good with the bad. And again, this is the importance of seeing somebody who so specializes in this, because there's a lot of different aspects. Remember, I told you erections, in order to get a good erection, the stars have to align. So there's a lot of different things that come into play here in order for you to have a good sexual experience.
Certainly. Thank you very much. I'm going to go ahead and wrap up our event here. I'd like to thank Dr. Martinez for taking the time to present today. And we'd also like to thank everyone for listening in and attending this MenMD The Focus webinar. We hope it was informative and you'll join us again in the future. If you'd like to learn more about injection therapy, you have a few options. There are also more resources in the Resource Center on menmd.com. Visit this page to view instructional videos, guides, expert articles, and more. You can also call MenMD at 857-233-5837 or log in to the password-protected, secure MenMD portal to schedule an appointment with a MenMD personal health assistant. If you're interested in injection accessories, you can learn more or purchase accessories on the shop page at menmd.com. I'd like to thank everyone again for attending today's webinar, and we'll see you at the next one.